Cervical cancer is a threat that silently claims the lives of far too many women every year. But amidst this darkness, there is hope, such as methods like HPV vaccination and cervical screenings that can help prevent it. Hi, I'm Swarnama Bhattacharya. I'm the co-founder of Gayatri, which is a women's health companion, and I'm here to deep dive into an important topic, HPV, otherwise called the Human Papillomavirus, its connection to certain cancers, and the ways to help protect oneself. Let's be honest, most of us are always avoiding going to the gynecologist because we experience a serious symptom and home remedies just won't work anymore. Often, there are some conditions which may not even show any symptoms and that could still pose a health risk if left undetected. I'm mainly talking about the viral infections like HPV that affect the reproductive tract in women. And we are here today to break it down for you. For that, we have invited Artika Singh, a sexual health educator, to help us understand the importance of sexual wellness and preventative care. Welcome, Artika, and let's deep dive into a topic of discussion.
Hi, Swarnama. Thank you so much for that lovely introduction. And also a big thank you to you and MST for providing us this platform to talk about this very important topic in, the women's health segment.
Yeah, so when it comes to women's health and in particular HPV and its related diseases and cancers, so HPV is a very commonly transmitted viral infection for the reproductive tract, right? However, there is a huge lack of knowledge and awareness around this topic because we don't discuss women's health as openly and as frequently as we should. And you know this, better than so many other people, Artika, being an asexual educator that you are. So why don't we begin by understanding what HPV really is?
I think definitely the first thing that you said so correctly, that there is a lack of awareness about HPV and about STIs in general, right? So I think just starting from the beginning, HPV or the human papillomavirus is a virus. It's actually a group of viruses. So there are about 100 types of strains, out of which about 14 are considered to be high risk currently. By high risk, we do mean that they're cancer causing strains as well. And like we talked about the reproductive tract. So HPV does infect the reproductive tract, and that also means that it mainly spreads through contact, skin to skin contact, especially during sexual activity. So I think one thing is it's a virus, there are 100 types, 14 are high risk, and that it does get acquired through sexual activity. I think it's really, really important to know one thing, which is that while many strains of HPV are harmless, the ones that are high risk can cause different kinds of cancers, including cervical cancer, vaginal cancer, cancer of the vulva, and even anal cancer. So that's why the knowledge of what HPV is, as well as of prevention, is extremely crucial, whether it's through vaccination or through screening.
Yeah, certainly. So, when you hear the word cancer, nothing else takes precedence. And the knowledge that cervical cancer can be prevented is quite the focal point here, since there's always been this smoke screen around cancer and whether cancer can even be prevented. So are there any symptoms to look out for?
Absolutely. I think it's very scary for people to talk about this, and that is in itself one of the reasons for lack of awareness. But yes, symptoms to look out for with HPV can be a little tricky because, like I said, some of them may cause very small symptoms, some of them may be asymptomatic. I think a word that we all learned during the pandemic applies here. And some of the HPV infections actually clear out on their own. So you may even have the virus and be harboring it, and it could be in incubation without knowing about it for years.
And that is, something that we have to sort of, keep in mind. And I think this is something I want to underline once again, that a lot of infections do not show symptoms. And, this HPV virus can be incubating for a long time before you know that something is really, really wrong. So that's why we just want to go back to the point of preventative screenings and such things. So, coming back to your point, what could happen in that case? If left undetected, what could happen in that case? What are the risks really?
Right. Actually, firstly, it would depend on the type of HPV that you've been infected with. Just going back, that there are 100 types. And depending on that, it could have severe to less severe health problems. Like we spoke about the cancers earlier, that's the most severe kind of problem that can exist with an HPV infection. The other things that happen with HPV commonly are the genital warts, which can very easily be treated by a medical professional as long as they're detected. There have been studies that show, studies amongst women that show that women can develop cervical cancer even 20 years after getting infected. And these are usually categorized as slow growing cancers. So, diagnosis is usually in the later stages where the symptoms have become very big. Like we were saying, that we only go to the doctor, when the symptom has become almost untreatable at home. And that is probably one of the reasons why cervical cancer has slowly become the second most common cancer amongst women, according to some studies.
Yeah, yeah. And that is actually quite alarming, and I really shudder to think of it that that you and I could be at risk. I mean, while we're sitting here and we're having a conversation, and if we have missed a couple of preventative screenings here and there, we don't know what really is going on. I mean, because not always do we have these symptoms. So that brings us to actually a much more important question. So, what can you tell us about cervical cancer in India, like more contextually speaking?
Right. I think if we look more specifically into some of the Indian statistics that are available, majority of cervical cancer cases are being tied back to HPV. And apart from talking about cancer, of course, almost 17% of fatalities that are happening are associated with HPV and cervical cancer, and is very, very rampant amongst the reproductive age group with respect to India. And I think that's a huge percentage, right? 17% is a huge percentage. And that really does become alarming, like you said, because 80% of HPV related cancers are actually preventable. But the fact that there is a gap in sort of screening, diagnosing, prevention is leading to such high number of mortality.
That's right. And thank you for really sharing that very crucial information. And so obviously when it comes to anything related to sexual or reproductive health, there is just as dangerous as missing your preventative screening is the presence of myths around it. And one of the things that people say very often is that if you have only one sexual partner, you don't need to get vaccinated. So is that really true?
Yeah, I think we hear that a lot in terms of number of partners to actually assess this. Sadly, it's not true. Regardless of whether you have one partner or you have more partners, an HPV vaccine is a preventive measure. So it will help prevent cervical cancer even if there has been an accidental exposure. And like I mentioned before, the diagnosis being so late is a problem in patients. And 90% of women who are in the sexually active phase can actually benefit from the HPV prevention, including the vaccine.
That's a great point to note. Now, let's focus on what individuals can do to really steer clear of HPV and cervical cancers, and what preventative measures they can take. For example, the Centers for Disease Control and Prevention recommends HPV vaccination to help reduce the risk of contracting the HPV infection, as well as regular cervical screenings for women to detect these early stage pre-cancers. So, Artika, can you tell us a little bit more about what screening really is and how does one go about it?
Absolutely. So the cervical screening is a simple test which is done to see if you've been exposed to HPV and whether it's causing any abnormalities in your cervix. I think the most common screening test that we have available right now, and people may have heard of, is the pap smear test. It's a very simple test that can be done with a simple pelvic exam by your doctor. And I'm using the word simple again and again to almost highlight that this is like doing any other regular blood work, blood test for anything else. So I think number one is it's best to talk to your gynecologist about, because ultimately they're the ones who will be helping you out with this pap smear test. The guidelines that we have currently are from the American College of OBGYNs, and those guidelines suggest that after the age of 21, you should be doing your pap smear, and you should be doing it roughly every 3 years if your test is all normal. In case of any abnormalities, again, you'll need to chat with your gynecologist about it, but it's recommended that you repeat it yearly if there are any abnormalities or anything alarming that comes out in the tests. So I think the frequency, how to do the procedure, whether it's scary or not, this is a conversation that you should definitely have with your gynecologist.
Yeah. So with all this said, there is a lot to take in, right from the fact that how prone anybody can be to the HPV infection, the fact that many of the times the symptoms are just left undetected, and the fact that there's a lot of myth and misinformation around HPV vaccine and the big C, that is cervical cancer. So where can the viewers really start their own journeys towards safeguarding their health and preventing cervical cancer?
Absolutely. I guess if I had to just really simplify it, step one would be to talk to your gynecologist. They're going to be your best buddies in this journey because you do need a vaccination and you do need a screening test, which you need medical intervention for. So talk to a trusted gynecologist. They'll be the ones who will be able to guide you through every step of the way. And the second thing is that the reliable source on the internet right now is letsfighthpv.com. It's something that I have read and so can vouch for. So that's a great place to start educating yourself as well as anybody else who it may be relevant information for. And I personally just feel the more you know, the more sort of controlled you feel and less scary it becomes. So those would be my 2 suggestions on this.
That's right. So you heard us. I think the first thing that you need to do is to, if you haven't done it already, set up an appointment with a gynac that you trust, so that you can take charge of your health and future well-being. Now, while these things sound very cliched, I think what the pandemic has taught us is, prevention is really the best cure. There's a lot of things that we can do which are preventative measures. So let's get started. Talk to your gynecologist, who will tell you what you need to do based on your health history, based on your age. And while you're at it, do like this video and follow MSD India for more such content. Thank you for watching.